Now let's take a look at this interesting study of the prefrontal cortex. Let's start here on the left. This is the chart showing the cards that a person would draw from one of two decks. So there are two decks of cards. In blue, we have the risky deck. In orange, we have the safe deck. Every time you draw from the blue deck, you might win a lot of money, but you might also lose a lot of money. It's more risky. The safe deck is kind of more boring. You might not make as much money, but you're also not going to lose as much money. And most people, we see here in the control group, are what's called risk averse. They don't like to lose anything, so they pretty quickly start just drawing from the orange safe deck. They'd rather make less money but not have to risk that they're going to lose a whole bunch of money whenever they draw from the blue deck. So they start drawing primarily from the orange deck. In contrast, individuals with damage to the prefrontal cortex don't show a preference for the safe deck. In fact, they seem to prefer the risky deck. That's kind of unusual, right? Now, at the same time, we can look and see how active the nervous system is, especially the sympathetic nervous system is, when playing this game and using these decks of cards. In a person without prefrontal cortex, just a perfectly normal, brain, they don't like to use the blue deck because they are risk averse. They are afraid they might draw from that card and lose money. And as a result, when they do draw from that deck, we see here that they have heightened what's called skin conductance responses. Skin conductance responses are a measure of the sweat glands on your fingers, right? And that basically saying that your palms are getting a little sweaty. And it's a measure of anxiety because your sympathetic nervous system is kicking in. And it makes sense. They're afraid to lose money. So every time they do draw from that blue deck, they're afraid they're going to lose money and they react with some nervousness. So they react with some sweat on their hands. In contrast, the patients with damage to the prefrontal cortex don't. They're pretty calm and relaxed throughout this whole thing. They don't have any kind of sort of nervous reaction. Now, we also mentioned the anterior cingulate cortex as being involved in our conscious experience of emotions and social pain and social rejection and emotional pain and stuff. A larger anterior cingulate cortex. So we can see here that the ACC, first off, the name is anterior, so it's telling us it's in the front, towards the front of the brain. So the anterior cingulate gyrus here, or cortex, is sort of an area of hidden cortex in the very middle of the brain. So the left and the right hemispheres kind of fold towards the middle, and if we were to stick our hands sort of down the middle between those two hemispheres, we would be able to come up here and encounter the ACC. A larger ACC is associated with a higher level of the personality characteristic of harm avoidance. Well, what's harm avoidance? Harm avoidance has to do with greater anxiety, more worry. You're just really kind of more motivated to avoid harm, and you're scared of things that might go wrong, essentially. So the ACC is definitely associated with these kinds of negative emotional reactions. And then we can also ask ourselves, is there an emotion center of the brain, or are there different centers of the brain for different emotions? And basically, no. So what we're seeing here is that the different dots represented in different colors are associated with these different emotions, and there's no pattern. There's happiness throughout the brain, sadness throughout the brain, disgust, fear, and so on. So there's no happy part of the brain, there's no sad part of the brain, there's no structure that only does anger, but instead they kind of do a variety of different things. Now that said, the amygdala is involved in emotions, but so are a whole bunch of other parts of the brain when we're experiencing emotion. And then, speaking of the experience of emotion, there seems to be some difference between the left and the right hemispheres, and this is called hemispheric specialization. And if you remember, the left and the right hemispheres of the brain, they're generally very similar, but there are some differences. And what we know is that the left frontal area, so if you think of the area of the brain kind of behind your left eye and where you're on the left side of your forehead, that area is involved in positive emotions and something called approach motivation, the motivation to go out and engage, to go out and be with other people or to do something. Damage to this area results in there being more anxiety in a person and sadness about life. Less activity in this area is seen in depressed people. So it's sort of an area that's associated with positive emotions and also kind of that go get 'em, right? That energized, I want to go do something. In contrast, the right frontal area is involved in more negative emotions and what's called avoidance motivation. So instead of going out and engaging with other people and with things, they're going to be more avoidant and kind of staying to themselves and so on. So these individuals with more activity in the right frontal lobe will have greater responses to emotional stimuli. So a scary picture is going to make their heart pound more, for example. There'll be more activity here in depressed people, and damage to this area. So if this area is damaged and not able to work properly, they will be kind of like totally okay, or even euphoric when bad things happen. So instead of being upset, they're going to be absolutely fine, or maybe even happy. Patients with right hemisphere damage have trouble recognizing emotion in facial expressions and tone of voice. So they have a hard time reading other people's emotions. Now here's a question. Do you think that changing the relative activity of the left and the right sides of the brain, like through something called neurofeedback, can change how people feel? So neurofeedback is like biofeedback, but specifically training you to use, for example, your left frontal lobe more, or to use your right frontal lobe less as a way of dealing with negative affect. Might this be sort of an interesting and possible remedy? And there is some research showing that yes, indeed, there are some benefits of neurofeedback. And so here we can see in this study, just an example, frontal alpha asymmetry neurofeedback for the reduction of negative affect and anxiety. They did use neurofeedback. They used essentially what's like a computer game to get people to increase brainwave called alpha on the right frontal side of the brain. And what they found was that reducing right frontal activity was mirrored by a decrease in negative affect and anxiety. In other words, they were able to lower a person's negative mood and lower their anxiety by reducing the amount of activity on the right frontal cortex. They conclude that it's a promising clinical tool for negative affect and anxiety. It didn't seem to have any effect on actual depression, though. So, the results of studies like this are often a little mixed, and they're not like a magic, treatment at all, but it is a possible therapeutic approach for some people.